Today, we're going to dive into this incredible story that a single blood test can tell about what's going on inside your body. It's all about balance, defense, and this razor-thin margin that separates being healthy from being critically ill.
I know, it sounds super dramatic, right? But it's absolutely true. There's a test called an arterial blood gas, or ABG, and it does exactly that. It's basically a snapshot of a high-stakes battle that's being fought inside your bloodstream every single second of every single day. So how on earth can one test reveal so much? Well, let's break it down.
So, here's our game plan. First, we're going to crack the code of the ABG test itself. Then, we'll get into the body's amazing balancing act, meet its rapid response team, and see what happens when that balance is totally lost. And finally, we'll talk about why this matters to every single one of us.
Okay, first things first, let's decode the numbers. An ABG test gives us a few key values that are kind of like vital signs for our internal chemistry.
All right, these are the main players on the field. You've got pH, which is the big picture, the overall acid-base balance. Then there's PaCO2, that's carbon dioxide, and it's all about the lungs. Bicarbonate is a base, and it's managed by your kidneys. And finally, PaO2, which tells us how much oxygen is in the blood, another key job for the lungs. So right away, you can see the lungs and the kidneys are the two master controllers in this whole system. So what's the end game here? What are all these systems trying to achieve? Well, it all boils down to one absolutely critical concept, this constant, relentless fight for equilibrium. And that concept has a name, homeostasis. It's your body's nonstop mission to keep its internal world stable and perfectly balanced, no matter what craziness is happening on the outside. And believe me, nowhere is this more important than when it comes to your blood's pH. I mean, just look at that range, 7.35 to 7.45. That's it. It is an incredibly tiny window. If your blood's pH dips just a little below that or goes just a little above it, your cells and your organs, they just can't work properly. It is an unbelievably precise balancing act. So how does the body pull this off? Well, a huge piece of the puzzle is how it deals with carbon dioxide, which we all produce just by living. And what's amazing is that while a little bit of CO2 hitches a ride on hemoglobin or dissolves in plasma, a massive 70% of it gets converted and carried around as bicarbonate. And that bicarbonate is the secret weapon, the key buffer that helps keep that pH absolutely perfect. And this brings us to what you could call the golden ratio. I want you to picture a chemical seesaw that your body has to keep perfectly level at all times. And to do that, it needs to maintain exactly 20 parts of that bicarbonate for every 1 part of carbonic acid. If that 20-to-1 ratio gets even slightly thrown off, the whole seesaw tips, and your body scrambles to fix it, usually by making you breathe faster or slower to adjust your CO2 levels and bring everything back into line. So we know this balance is crucial, but how does the body actually protect it? Well, it has this incredible multi-layered defense system. Think of it like a rapid response team that's on call 24/7 just to guard that golden ratio. And there are 3 distinct lines of defense. First up, the instant responders. These are chemical buffers right there in your blood, and they act within seconds. Then you've got the second line of defense, your lungs. They can change your breathing in just a few minutes to either blow off more CO2 or hold on to it. And finally, the heavy hitters, the third and most powerful line of defense, your kidneys. Now, they're slower, they take hours or even days to really kick in, but they can make huge, long-lasting changes by managing bicarbonate and getting rid of acid. But what happens when things go wrong? When this amazing defense system just gets completely overwhelmed and the balance is lost, that's when we get into trouble, in states we call either acidosis or alkalosis. And it's really pretty straightforward. Acidosis just means the blood has become too acidic. The pH drops below 7.35. And alkalosis means the blood is too basic, or alkaline, with a pH above 7.45. And I can't stress this enough, both of these are incredibly dangerous. So these imbalances can come from 2 main places. The first is a respiratory problem, meaning the lungs are the cause. In respiratory acidosis, the lungs just aren't getting rid of enough CO2, so it builds up and makes the blood acidic. On the flip side, in respiratory alkalosis, you're breathing way too fast, blowing off too much CO2, and that makes the blood too alkaline. Now, the other side of the coin is metabolic, which points to your kidneys and your body's general metabolism.
In metabolic acidosis, either your body's producing way too much acid or the kidneys just can't keep up with getting rid of it. You see that classic rapid breathing? That's the lungs, our second line of defense, working like crazy to try and compensate. Then with metabolic alkalosis, you've got too much bicarbonate, and that can lead to totally different symptoms, like muscle twitching.
So, what could possibly be powerful enough to knock this whole elegant system out of whack? Well, we're talking about serious stuff. Things like severe shock, which floods your body with lactic acid, or diabetic ketoacidosis, which turns out acidic things called ketones, or really any condition that causes an acute kidney injury, because that cripples the body's third and most powerful line of defense.
Okay, I know what you might be thinking. This all sounds like intense, critical care stuff that only matters in a hospital. But the truth is, the principles behind this delicate balance are essential to every single one of us, every single day.
Let's just let that sink in for a second. This isn't just about some numbers on a chart being a little off. An imbalance will literally, physically destroy your cells and your organs. This is why the body fights so hard every moment of the day to protect that tiny pH window. It is life or death. And this all comes back to you and the simple things you do every day. Just supporting your kidneys by staying hydrated is one of the best things you can do for your acid-base balance. You know that nagging headache you sometimes get? It could literally just be your body screaming for water. A healthy internal balance can even show up on the outside in things like healthier skin. And of course, keeping electrolytes like sodium and potassium in check is fundamental for everything from your heartbeat to your nerves firing properly.
So here's the bottom line. Your body is this incredible, self-regulating machine, and it's constantly performing this ridiculously complex balancing act without you ever having to think about it. The real question is, with your daily choices, the food you eat, the water you drink, are you helping it succeed?